United Nations General Assembly in 2007 designated April 2 as World Autism Awareness Day to affirm and promote the full realization of all human rights and fundamental freedoms for autistic people on an equal basis with others. It is celebrated annually to raise public awareness about autism, a complicated lifelong condition that affects the development of the brain, behavior, communication skills, interaction skills, and learning abilities, and 1 in every 100 children is affected by it, according to the World Health Organization. Studies show proper care is crucial in simplifying the lives of autistic individuals. On Wednesday, May 1, the Center for Democracy and Socioeconomic Development, CDS Africa, organized an engagement session for parents and caregivers of children with developmental disabilities at Weku Gardens in Accra. The session took the form of a focus group discussion where caregivers shared their unique challenges and successes in their line of work. Dr. Abena Boatin, the Director of Research at CDS Africa, used the occasion to shed light on the International Development Research Center grant, which will be implemented for 24 months to address the issue of unpaid care work by carers of children with developmental disabilities in Ghana.
We are all committed to finding lasting interventions and solutions, not just for those that can afford it, but especially for those who cannot even afford it. And it's heartbreaking that people in Accra are getting even the things that we are lamenting about that is non-existent. It's only all concentrated in Accra. So what about those in other places in the rural settings? The research that we are doing is called Recognizing the Unpaid Care Work for Caregivers of Children with Developmental Disabilities. One of the things that we are seeking to do with that work, first, is to recognize the care that is not as recognized as it should be, because we know it is lifelong, and then to also seek for interventions that will reduce the burden of care. What we are doing with that research, first of all, is to form a steering committee with stakeholders like yourselves, people who live the experience every day. We want to use the research to push government to make inclusive education implementable in all public schools. We know it's a huge task, but with commitment, we'll be able to do it.
Edna Asante, Programs Manager, and Celestina Damwa, Advocacy and Public Engagement Coordinator, moderated the session on management, challenges, and system support.
What disability does your ward have, and how was it diagnosed?
My ward has autism spectrum disorder, and when he was about, was it 3 years? 3 years or 4 years or so. He wasn't speaking. No matter what you do, he will not speak. You get it? So we started sending him to hospital around, but nobody could diagnose it until I saw a site online about autism and read what the characteristics or symptoms of autism were, and everything matched him, you know. So when I went to the hospital, I told them this is what I think is wrong with my son. And everybody since then, up to, we even went to the US to live there to take care of him. Everybody has agreed with me that it's autism. And this was how it happened, yes.
So many things have been quite difficult to handle, especially being a trained teacher and then a headmistress for over 30 years. You sit down and you see so many children, you know, you have, you know, looked after the teachers to look after the children, and the children have gone and they say they are graduating and they are engineers and they are doctors. And then you come back home and then you see your son. So you know, you really wonder. But as God is there, you just have to trust him. Yeah. There are also issues of financial. Sending him to school. Most of the schools didn't want to accept him.
to you, in as much as awareness has moved from where it was in the past, still we need the support of government, but it looks like government is not involved. It's just private individuals pushing the effort.
Exactly. They're not doing much. I think that most often they jump on these issues when it's time for International Day of this, and I feel like, what are you doing in that space? You know, instead of coming out and when it's International Day for this, you come out and release a communique. We don't want that anymore.
One-off ceremony, then
it's a one-off. That is all. Then we go to sleep. Yes, but the tax remains on all these stakeholders, as she just said. Look at the input she's making. She's been working within the space of education for some years now, and she, because of that, she was able to support her child. She has to do more research and so on. But if Ghana provided that facility, those facilities, she wouldn't have had any problem. She would just get to assimilate herself into the system, and she will get to understand certain things, and provided that the child will also get the opportunity he has. Because I believe that these children have very innate abilities, which are very unexplored in Ghana here. But outside, these children's abilities are explored. So we should, push forward for government to come on board.
I know you are into some form of consultancy. If you can tell us about it and then give us a rough estimate of how much you charge.
So for that one, normally, roughly, if we want to charge, we look at maybe when they bring the report, we look at the report and the intensity, the things that we are supposed to do. Some of the children, before you can even get the child to sit, you have to do a whole lot even before you get the child to sit. So with that one, if you don't charge maybe like 200 for an hour, yes. Wow. So if it is not any intense work to do, that one you can go for 150 for an hour.
Being a teacher, how do you prepare yourself to handle such challenges?
In the beginning, it was not easy, but as you get to know the child, you know their weaknesses and the things that makes them angry. You develop a plan to handle the situation when it comes to that.
We need voices, like Reverend. It's good that Reverend is here. We have the Christian councils, and the politicians listen to them. So if he can take all those Christian organization or the Muslim organization can actually take this thing up and then put it in front of the politicians, we can get a policy, and this can be implemented such that our parents with kids, we don't have to shake their pocket or dip their hand into their pocket for them to assess need. So first is the policy, and the implementation of the policy is very important.
What we want to achieve with these children, we said these children have a lot of skills, a lot of untapped, it's like they're untapped resources. So what are we doing with with them? My company, we really want to work with the older ones, like transition from school into the world of adults, but it's not happening so far, because when you get to this company, they give you stories and stories. But if you are able to collaborate with companies or with NGOs like you to get people to pay these special children whilst they are working, like their working time, you take them to the companies, they work and get paid by you, and then slowly we are integrating them into the system.
I really think consumers, and when I say consumers, I really mean parents and neurodivergent autistic adults, speaking or non-speaking, have the most power at the table. And I think when we have organizations making sure that stakeholder group knows that, you'll get whatever change you want. So when parents like ourselves and join with a lot of other parents, our kids are in somebody's school, or they have the purchasing potential in many cases to be in somebody's school, dollars or CDs or whatever it is, right? So when that group can organize well enough in small pockets here and there to go and push for, even in one school, policies to change, you will start to see those things change.
The call for joint effort by the private sector and government to tackle challenges faced by caregivers and children with developmental disabilities in Ghana still stands.